Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Monday, May 11th. I hope everyone had a wonderful Mother's Day. So all the moms out there, happy Mother's Day from yesterday. Hope you had a very special day. My name is John Bradford. I am your briefing call moderator. This will be our 8th week of doing 3 calls a week, giving you updates for the North Mecklenburg area specifically. I'm a small business owner. I have 2 companies right here in North Mecklenburg with about 40 employees, and I'm also a former member of the North Carolina House of Representatives. The purpose of these calls is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to update, educate, and support the North Mecklenburg region during the outbreak. As we are, some businesses in phase 1 are opening now, and so this is probably more important than other in terms of guidance for cleaning and disinfecting public spaces, workplaces, businesses, schools, and homes. There is a great one-page document on the CDC website. You can see it right here on your screen of how to develop your plan, implement your plan, maintain and revise disinfection and cleaning protocols. I'm just going to give you an example. My business, one of my businesses, pet screening. And you see a floor plan of what we've done to help with distancing. We've closed some office spaces, some cubicles. We've closed those off. So you see the words open, and then you see some dark blue blocks. Those are closed spaces. So what we've done is, as we have employees coming back, we're spacing people out to practice those protocols. We also have hand sanitizers that we've ordered, so that's all over the 2 levels of our offices. This is just an example of what my business is doing, one of my businesses is doing, to share with all of you as an example. In terms of total cases in the U.S., we are at 1,300,000 cases, 78,000 total deaths in the U.S. This was reported May the 10th, so it's already a few days old. And as you can see from the heat map, this heat map's getting lots of different colors here. But North Carolina is, running probably middle in the pack. We're definitely not a hot spot like you see down in Florida or California or even in New England like New York, et cetera. But South Carolina is a different shade of orange than North Carolina. But of course, they have less population. But in North Carolina, we are definitely, I think, done a relatively good job here as a state. COVID-19 dashboard, this is hot off the press. We're at 550 deaths. Comparing that to our Friday's update, we're at 527 deaths. So there's been just a few uptick there in death count. Hospitalization, notably, has gone down. It was 515 on Friday. It's now 464. The number of counties is still holding at 9. There's one county that does not have any reported case. We'll see if that can hold. I suspect that'll eventually flip, but 99 out of 100 counties are impacted. In terms of just data, look at these curves. Positive tests as a percent of total tests, you can definitely see it's trending down. This is statewide data, by the way. And then the current COVID hospitalizations, you can also see, follow that dotted blue line, it's also starting to turn down. These are signs that I think are just great signals as we hopefully are getting back to some day, but just wanted to share that with you. Phase 1, we are under phase 1 that started Friday at 5 p.m., so we're still under a stay-at-home executive order. Phase 1 will tentatively expire May 22nd at 5 p.m. of when we're going to move into phase 2. I would just encourage you to know the difference between, phase 1, phase 2, and phase 3. I'm not going to go into great detail here because we've done that on prior calls, but we are under phase 1. Most businesses can open, although there are specific types of businesses that must remain closed, and you can find those on the Department of Health and Human Services website and Mecklenburg website. Restaurants are still closed for dine-in and patio service, but you can do drive-through, takeout, and delivery. So just know that we are in phase 1. Phase 2 is going to tentatively start on May 22nd at 5 p.m. And this, to me, is really going to see where we're going to really start to see some changes, because now the stay-at-home order will be lifted, which means there will be a limited opening of restaurants, bars, and other types of services, probably salons, I would imagine, as long as it's reduced capacity and safety protocols. So phase 2 is really what I want to see us get to quickly, and that should hopefully happen May 22nd at 5 p.m. Then we're going to have to get through phase 2, and they're saying that's going to be about 4 to 6 weeks, which puts us out to about June 19th to July the 3rd, and then that's when we're going to go into phase 3. And phase 3 is even more relaxed than phase 2. Just remember the 3 W's: wear a face covering, wash your hands for 20 seconds, or use hand sanitizer, and wait 6 feet apart from other people. You can see a graphic here. Wear, wait, wash. And those are 3 W's that are, being, so this little 3W thing is being pushed across the state. If you need some face cloth coverings, shop.enderamills, $2 a piece. You order 12. They have youth sizes, adult sizes. These are cotton. You can wash them. I've ordered some for my family, friends, employees. I encourage you to order some if you need them. I find them to be comfortable, so no problems wearing them in my opinion. But here's the website, shop.enderamills.com. And it is notable, this is a North Carolina-based company. Mecklenburg County data, and we're going to hear some stuff from Commissioner Pat Cotham in a few minutes. But in terms of cases, we're at 2,106 positive cases, 63 deaths. And this graph you see is a daily percent of positive laboratory COVID tests. And once again, you can see that trending is coming down. And this graph, by the way, is from May the 6th. So this is already a few days old. But you can clearly see that red line dropping. And in terms of cases in North Mecklenburg, Huntersville, Cornelius, and Davidson, you can see the heat map here. There's cases throughout North Meck, but I just wanted to share with you the latest heat map. Now, I don't know if we're lucky enough to have U.S. Congressman Greg Murphy with us today. He was at the hospital and was going to try to join. He's a Davidson College alumnus. He represents the 3rd District. He has been on several of our calls. He's been done great work for North Carolina, great work for the country as a congressman, and he's the only practicing physician in Congress. Dr. Murphy, are you with us by chance?
I am. I was able to get out of the hospital. Thank you for having me.
You bet. Happy Mother's Day to your wife, by the way.
Yes, thank you, and same to yours.
Thank you.
I'll give you a little update. I was back in Washington, D.C. last week. We're still waiting for Speaker Pelosi to call us back. There's a great movement in D.C. that we should be back doing the work of the people if we're expecting other people to work. Why are we not back in Congress? So I have to admit, I'm really frustrated with that again. Obviously, I'm doing teletown halls. I'm doing tons of teleconferences, but being in D.C. and working with colleagues is what we're asked to do by our constituents, and that's what we should be doing. The main focus last week was, as you point out, the numbers are improving. And, you look at specifically the numbers in North Carolina are definitely improving, and they have been improving. The metrics that we need to make the step forward are there. And, I will tell you, our unemployment numbers are staggering, if not crippling. Meeting with Secretary Mnuchin last week also, this is a very, very difficult time. I will tell you personally, I'm going to have a hard time signing on for another $2 trillion to come out and be printed of money out of the government, which we don't have, when we should be able to and can safely get our workforce back to work. People want to work, and that's where we need to go ahead and move. I think our metrics are there. I think there's a great fallacy going around that if we stay in our house, that this virus is going to go away by itself. To be very honest with you, I think it's going to be 2 years until we get the medical situation fully under control. We finally were able to get data from Raleigh telling us about who are the people that have been most severely affected, and those are our elderly with significant comorbid diseases and those in our nursing homes. 60% of the individuals who have passed away are individuals that have been in our nursing home, and we know, unfortunately, those individuals are very sick or else they would not be there. And so the information is there to how smartly and intelligently move forward. I've asked our leadership in our state that they consider regional approaches to doing this. Eastern North Carolina, we have been spared with cases and done a very, very good job of this. Personally, I think we could move forward on a much quicker pace than what we're moving, just because I believe the data shows that. And as a physician, I think I feel that I look at the data very critically. So we're in a critical time in our nation. China has not been our friend throughout this. We need to look at and see what other countries have done. If you compare us to Western Europe, the countries of France, Belgium, UK, Spain, we have done better than any of those countries. And I think it's the determination and will of this country that has shown that. So we're working forward. I really do think there's a pathway forward. Unfortunately, and I say this with great regret, politics has now reared its ugly head in this crisis. This should have been something that we all got together behind, but unfortunately politics is there. It infuriates me, to be very honest with you. I think there's a pathway for all of us to be united as a nation to move forward. So, John, I thank you for doing these. I think it's so important that people hear good, educated facts about what's going on, and so they know a trusted news source. So thank you very much for your leadership. Thank you for having me.
You bet, and thank you again for taking your time to join us. Thanks for what you're doing for our country and for North Carolina. You are very, very appreciated, Congressman. Moving on to Mecklenburg County Commissioner Pat Cotham. Pat has been on every single call. She is, I consider her to be a good friend and really does the people's work, and we're happy to have her. So, Commissioner Cotham, the microphone's yours.
All right. Well, thank you very much. Today I want to talk about numbers, some different numbers. We just received the first numbers of our unemployment for March. It does take a while to get these numbers together, but I'm sure these numbers will, when we get the April numbers, will go up substantially. But in March, for people wanting unemployment insurance, there were 42,542. And of that group, 60% of them were women and 40% were men. And 45% were white, 33% were African American, 10% were unknown race, and 8% were Asian Pacific Islander. Now, of these people from Mecklenburg County who were wanting unemployment, who applied for unemployment insurance, the biggest industry, which was really no surprise, I guess, was leisure and hospitality. So that's the restaurants and the hotels. So that was the biggest number, and that was 33% of the people were from that industry. The next big industry was trade, transportation, and utilities, and that was 15%. Education and health services, that was 12% of the people. And but it was interesting to see that breakdown. And I can send some of the more details to you, John, so you can have them if you get questions or you want to post it.
Okay.
Again, going back to these 42,000 claims, let's talk about the ages of the people. 17% of them in March were under 25. 33% were between 25 and 34 years old. 20% were between 35 and 44. 16% were between 45 and 54. And 6% were 55 to 59%. And the remainder was people who were older, but there weren't too many. So that's the unemployment in March. Okay, now I want to switch to the Mecklenburg County, our cost we've had so far from COVID. So far, we've spent $11,109,000 on it. And I'm not going to list all of the numbers, but I want to give you some of the interesting numbers and some of the bigger numbers. Some of the bigger numbers were 5.5 million. That was for loans for small businesses that we've done so far. And another big number was 1,254,000, and that was for hotel leases for homeless families and people who were sick and didn't have a place to go. We've also contributed $1.3 million to the fund that's being managed by United Way. And we've had some other interesting numbers. Cleaning supplies, cleaning equipment and supplies, $145,000. Meals delivered to first responders and to people in need, $113,000. Technology was $1.7 million. Now, a lot of that were more laptops to help employees work from home and to work we're out in the field. So that I remember that that was like one of the first things that we purchased. And of that technology, that included support for deployment of it. I mean, the actual computers were 1.4 million, and then deployment was 172,000, and other things like DocuSign and WebEx is $149,000. But this number kind of freaked me out. It was the first number on the list, and it said cadaver bags and shrouds. That kind of took my breath away. $2,372. That kind of took my breath away. And Also, toilet paper, paper towels, toilet seat covers, $6,680. And let's see, I saw one for the porta potties that we had uptown. I think it was like, here it is, $2,800 we spent so far on that. But anyway, those are just some of the interesting numbers that we don't normally hear. And I'm sure these numbers, the unemployment numbers, will go up substantially in April, but at least you kind of know where the numbers started in March. So that's my report. That's all I have.
Thank you. Thank you so much, Commissioner, and we look forward to talking to you again on Wednesday. Thanks for all you do in your leadership.
Thank you.
You bet. We are going to now move to the town of Cornelius, and we are joined by Cornelius Mayor Woody Washam. Mayor, the microphone's yours.
Thank you so much, John. I appreciate that. It's good to be here today. We did enjoy many more of our retail establishments opening up in our community over the weekend. That was a good feeling. I was out and about in a couple of them, wearing my mask and keeping my social distance, or trying to, from folks. So I think that's going okay. I'm hoping and praying it is. During phase one, all of our town facilities will remain closed, and our staff that can telecommute will be continuing to do that. We may start opening up our town facilities somewhat in phase two, but we're going to do it slowly and very calculated. So it's important to us to get our local economy moving again. We realize that it's still a highly contagious virus and situation that we're dealing with out there, and we really want to continue to monitor the impact throughout our community. We also continuously encourage our citizens to stay at home. There is a stay-at-home order still out there, and to practice the social distancing and wearing the mask when they're out and about. Most folks are doing a pretty good job with all that. Now I want to talk just a little bit about, there's been some dialogue in our community about autumn care in particularly, and I'd like to address some things. I know, John, you try to address things that are not true that are out there, and I'd like to do the same thing as it relates to autumn care. Unfortunately, there have been a high number of COVID-19 cases and deaths at autumn care, as well as many of our long-term facilities around the country. Residents in all these facilities are certainly characterized for the most part being high risk and among the most susceptible to this virus. And we care very much about these folks at autumn care. It concerns me greatly, and but we have to keep in mind that autumn care is licensed and regulated by the state of North Carolina Health and Human Services Division, and the state performs lots of routine inspections as per the license requirements and agreements. And Mecklenburg County works with autumn care and has done that throughout this pandemic. I want you to know too that all of our current and former town officials should be aware, are aware. I know our board is aware that as a municipality, the town does not have any authority over the operations and health standard compliance of long-term facilities. We don't receive inspection reports for these facilities, and it would be legally inappropriate for us to comment on the facility operations because we don't get those reports. Mecklenburg County Health Department is staffed with health and professionals that are responsible for coordinating and interacting with autumn care during this pandemic. And as a town, we've partnered closely with our health director, Gibby Harris, for this crisis, and have been doing that for some time now. We get daily reports from her. I've had multiple phone conversations with her, as our town manager has as well. So we are keeping in touch. The county has implemented various precautions to protect residents and staff at all the long-term care facilities, which included restricting the visitors a while back and providing PPE for staff and isolated infected residences and again, their entire staff. But specific to autumn care, Medical Director Harris has had several conversations with facility and its medical director to address the needs that are particularly for that particular facility. And that's matters of providing testing supplies and additional PPE and guidance and inspections on current protocols and processes that are required in those types of facilities. Since reports of the first cases, public health staff has been in daily contact for the most part with this facility to review current cases of residents and staff, reinforce current guidance, and make recommendations regarding additional steps and to offer whatever support they can. The town has shared community concerns about autumn care with Mecklenburg County. As I said, we've talked to the health director multiple times. I've been involved in those conversations. The county's been very responsive. I know that there was dialogue between me and several constituents in my town over the weekend with medical director and others related to autumn care specifically and the fact that they had loved ones there. And we really appreciate Gibby Harris and her staff during probably the most challenging times that you could ever imagine. And we really hope to see an end of this pandemic soon, and particularly the part of it that's directed toward autumn care, which has the bulk of our infected folks and deaths are related to that one facility, and that's very sad. And I'm so sorry about that. Well, anyway, we'll continue in Cornelius to reinforce the state stay-at-home orders and the CDC guidelines and the social distancing in our community, and hope for the best that we can get through this whole situation sooner than later. And that's all I have, John. Thank you.
Okay, you bet. Thank you, Mayor, for that update. Moving now to the town of Huntersville, we're joined by Huntersville Mayor John Aneralla. Mayor, the microphone's yours.
Well, thanks, John, and thank you for hosting. It was a big day in Huntersville and probably the rest of North Carolina and the United States yesterday, Mother's Day. And I can tell you, it looked like a lot of people were going to visit Mom and for the most part doing what they felt comfortable with doing. Probably won't see as many people out for Dad's Day next month, but it looked like Mother's Day was pretty successful. And then really from my point of view, I didn't really drive around too much, but I did talk to some neighbors and friends and family, and it looked like people have started to go out to some of the quote unquote non-essential businesses that they've been meaning to go to over the last 6 or 7 weeks. Didn't seem like there was an overcrowding at any one of those establishments. Also, and I don't know if this is just anecdotal or not, but just driving around and walking around in some of the neighborhoods, I saw a lot more for sale signs. And if you recall, about a week and a half ago when we started to align with the governor, the rules were eased for for realtors. And maybe that's a good sign. I saw some of them were actually closing on some of the houses as well. But I really don't have too much. I do want to say that I am sitting right now getting ready to give blood at Davidson United Methodist Red Cross Drive. And they are desperately in need, and they're taking all kinds of protocols. I got to wear a mask and do various other things. But if you have some time, which a lot of us have a little extra time, I would go to the Red Cross and see when the next or the nearest blood drive is, and try to go to that, because that's one of the key things that are lacking right now. And John, that's really all I have. So have a great day, everybody.
Yeah, thank you, and happy Mother's Day to your wives and your mom as well. So thank you, John. Let's see, moving to the town of Davidson. Actually, Commissioner Matt Fort, he texted me, could not join today. He did just want me to tell everyone they have a town board meeting tomorrow night. It'll be virtual, of course, and he'll report on that on our Wednesday briefing. So now moving to CMS District 1 board member Rhonda Cheek. Hopefully Rhonda's got some news for us with some graduation updates. The microphone is yours, Rhonda.
Thanks, John. I appreciate you having us here today. You know, I don't have any great news yet to report because based on what we're still hearing from the county, state health departments and the State Board of Education, they are really discouraging any in-person graduations in the next 6 to 8 weeks. So Wake County has already announced that they won't be doing in-person graduations and are looking at virtual options. And CMS has embarked upon a survey of their students with a virtual ceremony and then some other options for how to pick up diplomas or potentially do a future celebration. So all of those mean that we're kind of heading towards an announcement and a decision to cancel in-person graduations. It looks highly likely. Very disappointed. I'm a parent of a senior. I've had a lot of people express a lot of frustration with me about this, and you know, we're being told no gatherings over 50, and that pretty much knocks out public graduations.
Well, yeah, Rhonda, that's tough, and I know Mason personally. I've kind of seen him grow up the last few years, so congratulations to him and all the other seniors out there. And I know you're doing everything you can, Rhonda, and this is bigger than all of us. And just keep us posted on what you're hearing. I heard it must be a rumor. I heard something about the racetrack being used for graduation in Cabarrus County, but I've not confirmed that. I was curious if you've heard anything about that either.
Yes, Cabarrus County has announced that all of their schools will have a virtual graduation held at the whatever it's called, Lowe's Cabarrus Motor Speedway, the Charlotte Motor Speedway over there.
Okay.
They have a dozen or more high schools over there scheduled to do that. Now, what they're doing is they're going to have one of the schools will line up at different times. They'll have a welcome by the principal, apparently on the big screens, and then they'll drive around the track and they'll hand them their diploma into the window. So it's a drive-through graduation, just held at the Speedway.
Wow.
Different option. We're looking at virtual ceremonies where all the kids' pictures flash up, where the key speakers that usually would speak are speaking, and then there'll be a tape of that for people to keep, for their viewing pleasure in the future. And then another way to celebrate them by picking up the diplomas. One of the schools I know in our area, Lake Norman area here, is planning at Huff. They're actually planning to have kids queue up in the bus lot. When they get to a stage, the kid will get out of the car, walk across the stage and pick up their diploma. Parents will take pictures. At the end of the stage, they'll get back in the car and drive off. So we're looking for ways to still celebrate these kids and honor them in a special way that's personalized and stay safe and within the guidelines.
Very good. Okay, well, we look forward to hearing more as you have updates, and thanks for taking part of your time to update us. You're much appreciated, Rhonda. Thank you.
Thanks. Bye-bye.
You're very welcome. Now we're going to move to our Chief Executive Officer of the Lake Norman Chamber of Commerce, and he's always early on these calls, always dial in, and he always beats me on the call. So gotta love Bill. You guys are doing a great job at the Lake Norman Chamber. So I'd love to hear an update from you, sir.
Thank you, John. Actually, we have a great deal to report. Very excited that business is opening up again to Lake with the governor's order moving into phase 1 on Friday. We started seeing businesses already opening up on Friday and certainly on Saturday. The Chamber of Commerce, we have published a restart guide, Restart Lake Norman. It's on our website at lakenormanchamber.org. It is a comprehensive guide that covers businesses from accommodations and lodging all the way down to retail, making sure that when you are opening up, you're doing so in a very safe manner for your employees, for your customers, for your clients. I strongly encourage you, whether you're a Lake Norman Chamber of Commerce member or not, if you're a business operating in Cornelius, Davidson, Huntersville, Mooresville, Denver, please consider going to our website. Look for this Restart LKN. It's a smart restart guide, and you can download it. It's very comprehensive, and you want to exercise some of those protocols and procedures. We've also published some of our Chamber of Commerce members who are in the cleaning business, who not only do cleaning, but they also have cleaning supplies. So you can go to our website and see a list of those businesses, because over the course of the next, well, for the foreseeable future, we have got to maintain and make sure we have clean environments for those customers, clients, and employees. And so, again, a list of those particular businesses. The Chamber of Commerce is really excited to be able to continue to honor small business. As I mentioned last week, the Small Business Administration really originally designated May 4th through the 11th as Small Business Week. And with the pandemic, they kicked that down the road. We don't know when they're going to be celebrating, but we began to honor our small businesses last week with a series of events, and we continue this week. We have a fantastic program. John, you know it, for 7 years we have put on the Small Business Event of the Year. We typically have one nationally renowned keynote speaker with several other speakers. We have lined up tonight, tomorrow, and Wednesday night, 7 o'clock to 9 o'clock p.m. with WSIC 105.9 FM that covers Statesville to Huntersville, but it'll also be Facebook Live. We have a 3-night extravaganza of a little inspiration, a touch of motivation, and a lot of laughs. And tonight we kick off with Chuck Gallagher, who was our keynote speaker a couple of years ago. You may remember Chuck. He's going to be speaking on the distinctive advantage. Tomorrow night, Tuesday, May the 12th, from 7 to 9, we're going to have Kathy McAfee, who again is a motivational speaker and business coach. And she's going to be speaking on the Fearless Leader. And then we wrap up Wednesday night with Steve Gilliland. He was our keynote speaker last year and just absolutely kept us in stitches. We were laughing so hard. But he's going to be talking about emerging from this pandemic. So again, 7 o'clock to 9 o'clock. If you do miss the show, which is Facebook Live and on WSIC, it's going to be recorded and you can catch it later. Thursday, we continue that honoring small business with a program on selling, and we're calling it Selling in the New Norm. I don't want to consider this the new norm, but it is going to be an adjustment for everybody. How do we sell in today's environment versus what we did 60, 90, 120 days ago? And so we have that program coming up on Thursday. We wrap the week on Friday with Atrium Healthcare and Novant Health are both bringing some speakers, and we're going to talk about the stress that COVID-19 has placed on business owners, business managers, their employees, and families. Tremendous stress. I know there's a lot of, right now there are still some mixed feelings about opening businesses up. I've read on Facebook posts, I'm sure you have, with people saying we need to continue to stay home. Many of those people citing that probably aren't small business owners. And if we don't get these businesses restarted now, we may never see their doors open back up. So it's extremely important that we get these businesses open. We put people back to work. We get consumers in there shopping and clients there. I don't know about you, John, but I need a haircut. So I'm really excited when phase 2 starts, because if you look at, I've got that program tonight, and Bill Russell took out some scissors and I trimmed my own hair just because this is just getting too long. But I tell you what, I am going to be excited when we do move into phase 2. And I think you mentioned May 20th is about what we're looking at. But very excited with everything going on. Please go to our website, lakenormanchamber.org, because all of these materials are there. And also some of the materials, if you're a business that never did get your PPP in, there's information there about the Paycheck Protection Program. We have other information about if you're a retailer, some of the things that you can be doing as a retailer. So again, a host of information, lakenormanchamber.org. And as always, John, thank you for providing this information. This has been a tremendous forum to get the message out to folks who are concerned about their business and want to know what's going on. This has been a tremendous resource from Congressman, our county commissioner, our town mayors, school board. It's just been fantastic. So thank you for doing this.
No, you bet. And I would love to see you in a man bun. Maybe you could sport one of those.
That's not going to happen.
Well, we appreciate your leadership. So thank you very much, Bill. Thank you. Just letting you know, the Huntersville Regional Chamber, here's their website. So there is another chamber here locally, and we have an open invitation to them. So feel free to go check out their website to see what they're up to. Let's see, visit Lake Norman. Just Sally Ashworth, the executive director. They have a really talented, they have a small but a mighty staff over there. They're really doing some creative things, and they just started these care packages. And you can go to their website, visit lakenorman.org, and you can order Lake Norman sort of branded paraphernalia, and you can include special messages like thinking of you, miss you, I love you, and they will box it up and ship it the same day. And there's a lot of neat merchandise on the website, all LKN related. So these are some great ways to send out some things to maybe friends or close ones or loved ones, or just to employees for a job well done. So visit Lake Norman, being creative once again. Just want to share that with you. I want to thank all of our moderators. Every Wednesday, we're lucky to have the United States Small Business Administration North Carolina Director, Thomas Stith III. He'll be on our call Wednesday, giving you updates on the EIDL program, the Emergency Economic Disaster Loan, the PPP program, Paycheck Protection Program, and a lot of other things. So we'll have him on Wednesday's call. Dr. Jack Faircloth is now with Atrium, and so he could not join today, but We've had just a fantastic group of briefing panelists, and I appreciate them so much. And I know all of you that tune in appreciate them as well. These are real leaders from government to the private sector and the chamber. So much appreciated. Our next call will be Wednesday, May the 13th. Keep the emails coming, lkntogether@gmail.com. That's lkntogether@gmail.com. I post these to Elect Bradford. You can follow that on Facebook. I post these recorded right away when we're done. Send the emails to lkntogether@gmail. We are stronger together. Take care of yourself. Take care of each other. Thank you for listening. This does conclude today's briefing call.